Now time for our panel of experts. Karen Freeman-Wilson is the president and CEO of the Chicago Urban League, where she's been active in raising awareness around opioid addiction in the Black community. I should also say she was the very cool former mayor of Gary, Indiana, and I remember talking to her way back then, so it's good to see you. I'm going to make sure I pronounce this, Yngvild Olsen. Please tell me, Dr. Olsen, if I'm getting that right. She is the medical director of the Institutes for Behavior Resources and Outpatient Addiction Treatment Center here nearby in Baltimore. She's also vice president of the American Society of Addiction Medicine and the co-author of a book titled The Opioid Epidemic, What Everyone Needs to Know. And finally, she recently was a part of the Biden Transition's HHS review team, so she knows what they're going to do. She's going to let us, behind the curtains, I hope. And Dr. Westley Clark is currently a Dean's Executive Professor of Public Health at Santa Clara University, formerly the Director of the Center for Substance Abuse Treatment at the Department of Health and Human Services, where he served for 16 years. Thank you all for joining me today. This is a sobering conversation, and I try to have energy in these conversations, but I know it's a tough haul and a very, very tough on so many Americans right now during the time of this COVID pandemic. Let me just start with you, Karen, the should say, mayor. I used to mayor on
please
this.
say Karen. It's snowing outside. I don't want any responsibility today.
That's great. Well, Karen, let me ask you. I mean, I look at things oftentimes of, what has priority on the dashboard when you're a policymaker and you're looking at the hard choices you have. We don't have, infinite resources or even infinite attention. And I think part of the challenge today is how do we make sure that the right communities are part of that policy dashboard, part of the policy priority picture. And I'm interested in your perspective. I mean, the Chicago Urban League published something in 2017 I found fascinating called Whitewashed that dealt with a lot of these issues. And I'm interested in what you think is missing that we absolutely have to hear.
Well, first, I want to thank you for raising this and for the opportunity to join this panel. And one of the things that we always have to look at is the ability to protect our most vulnerable citizens. Whether we're talking about youth, whether we're talking about our seniors, we know that those who are addicted to alcohol and other drugs suffer, and they have to have access to the treatment that they need. And that is why we did Whitewashed back in 2017, because we understood that there was a focus on white suburban youth, but that the opioid epidemic was certainly impacting and had been impacting the Black community for some time. And it's our position that it's not either or, it's both and. And so we want treatment on demand. We want access to treatment. I want to certainly commend the Biden administration for this focal point, but we also know that we need that treatment in the justice system, and that's where drug treatment courts and treatment through the court system comes in.
Well, Doctor, thank you for that. Dr. Clark, I just want to read a section of something that you wrote that builds on what Karen just said. You said, Black patients come to substance use disorder treatment with a spectrum of experiences that traditional paradigms of medical intervention often don't address. I've found that unitary concepts such as abstinence or harm reduction or dependence and even drug use are inadequate constructs in the lives of Black patients seeking support in this area. I feel very powerful because I think a lot of folks don't have easy on-ramps where they understand the systemic issues that are involved. And I would love to get your view of how we reach these vulnerable communities, but how often we make mistakes in how we try and reach them. I think you're on mute, Dr. Clark. But you looked like you were jumping out of your chair. Go ahead.
Well, like Mayor Wilson, Freeman-Wilson, I want to thank you for addressing some of these issues, and these are critical issues. One of the things is that people fail to realize is that as a result of the criminal justice issue, Black patients are often stigmatized, suffer discrimination because of some of the criminal justice related issues. And people tend to look at it only in terms of medication, only in terms of the drug use. But in fact, when you're locked out of society, when you are precluded from participating because you are a felon by circumstance, drug use in the inner cities or among Black people results in criminal sanctions, whereas drug use among white people results often in a slap on the wrist or being directed to substance abuse treatment, which is accessible. So we're dealing with the issue of stigma, discrimination, and access to treatment. And we're dealing with policies that limit people of color from participating in the substance use phenomena. The fact that people are worried about overdose is great, and I really want to commend the Biden administration for its comprehensive view of how we're going to deal with some of these issues. But the key issue is making sure that people see that Black, Hispanic, American Indian, Alaska Natives, and even to a lesser extent, the Asian American community, because as a treatment provider, Asians also suffer from substance use disorders, and they tend to get forgotten because, quote, they're the model citizens. And some of my Asian colleagues point out that that isn't the case. They may not have the prevalence rate, but they have some of the similar issues. But discrimination, stigma, and lack of access are key issues. Housing, employment, access to food, being able to be parents. And one of the things we know about Black overdose rates is that the Black people tend to be older, and that's in part because they get incarcerated. And by the time you get out of the criminal justice system, you have a lot of other problems, and you don't fare as well.
So we've had just, two snapshots, Dr. Olsen, that say that, as you kind of look at the communities that have been sort of left marginalized, not in the, main thing, I worry a lot because I've visited cities. I've kind of spent a lot of time trying to investigate both in rural communities, rural West Virginia, but also, in a lot of the areas that Karen deals with in Urban League, right in, the center of our cities, how so many people can be left off the map. I want to bring in the mental health picture on this, Dr. Olsen, and let's put Dr. Olsen on the screen here. So I can see her. There we go. But ask you to basically chat with us, for a moment about what we're missing on the mental health front. And I'll just put a little preamble on it. Francis Suarez, the mayor of Miami, is someone I've become friends, but began talking to him about coronavirus early on last March in my daily coronavirus report back then. And he said, Steve, the thing nobody's talking about while this is going on is the severe impact on mental health and all of the downstream behaviors in this time of stress. Everyone's afraid to talk about it. Everyone's afraid to help. I'd like to get your snapshot because that was last March when I had that discussion with Mayor Suarez. So to give us an understanding and an on-ramp into this that makes it more real for us.
Yes, no, and first, thank you also for having me as part of this very distinguished panel on this very important topic. I think we all have experienced that, over the last year with COVID, that everyone is feeling increased stress, isolation. We have data from the Centers for Disease Control in August that shows that about 40% of Americans report experiencing at least one symptom of either depression, anxiety, or something called stress-related disorder. So certainly large percentages of the population are really being impacted very significantly with respect to mental health. That is especially true in our young people, 18 to 24-year-olds. The CDC actually noted that close to 75% of that age group is really struggling with those types of symptoms. And when you look at actually the intersection between mental health and substance use disorders, we know even before COVID that the co-occurrence or kind of the simultaneous occurrence of depression, anxiety, and substance use disorders is, prevalent. We see it in about 40 to 50%, sometimes even higher in certain populations. So when you think about kind of the economic stress, the isolation, the increases in these symptoms of depression and anxiety, and you then bring in the substance use disorders, it really is kind of a perfect storm, for many, many, many vulnerable individuals, as has already been mentioned, to then really be in very, very precarious situations. I think the other point I would make is that for people not only who already have a substance use disorder, particularly an opiate use disorder, that the situation becomes even that more critical because the substances that are now really prominent on the street, fentanyl, is so lethal. And so when you have individuals then who are now, trying to kind of deal with the symptoms that they're experiencing, the problems with mental health, and the lethality of what is available, and then on top of that, really then being cut off perhaps from their healthcare providers, from their therapists, from their physicians, and really having to try and kind of navigate this telehealth world, it really is a serious issue.
Let me thank you for that. Let me just ask you all a question. I sometimes don't know how my own questions are going to come out. This is not written down. Watching the COVID crisis, watching people scramble for the vaccines. I'm on the alert every day from the city of DC telling me if I'm going to, be in the right zip code or on the list or what, and I'm sure many, many other people, who are actually way further up the list than I am are looking at this. When you get to something like opioid addiction or a substance use disorder, and you have got to interact to try to get support. Dr. Lena Wen, when she was the health commissioner for the city of Baltimore, issued essentially a citywide prescription to get everyone essentially over-the-counter access. I thought it was an incredibly bold move. Now, that was years ago. I don't know the state of play today. Karen, I don't know if you're in the world of that urban leagues all around America are dealing with, whether those access points are easy, hard, complicated, whether the notion that people have to sign up online or see a health practitioner. I'd like to hear from each of you, if you don't mind. What do you think are the roadblocks that we need to get out of the way, or what are the pieces of infrastructure we really need to kind of get help to people where they are? Karen?
I think that you find that everything is harder to access under COVID, and that's unfortunate. And so you will find that treatment, particularly medically assisted treatment, is more difficult to access. But the way that it was done in Baltimore gives all cities an opportunity to, quite frankly, get it right. The issue, though, is the prioritization for funding, because we know it's not free. And so how do you get cities to say, this is a priority. This is as important as the vaccine. This is as important as insulin. This is as important as other things. And I think the way you do is treat it as a public health crisis, the public health crisis that it is.
Do you think the Biden administration, Urban League is such a powerful group, and your National Association of Urban Leagues, are they hearing that message?
We are hearing that substance abuse is something, and substance use will be a priority and is a priority in this administration. But ultimately, you determine what priorities are by what you see funded. And that's so it can be a priority of the administration, but if Congress does not provide the appropriation, then you will see that it can't be that much of a priority. We're hoping that it will be treated that way by Congress.
Let me ask Yngvild and Westley Clark the same question, but slightly different. Both of you in your writing, which I've taken a look at, really deal with the systemic dimensions, all the surround sound of this problem, as opposed to, here's one track and we just approached that track. So we need a systemic answer to deal with this systemic problem. And so, Westley, what would you prioritize in that? I've been reading carefully what you've written in it, so it's a big lift when you're kind of, trying to deal with all the different dimensions. And I'm just going to ask you whether you're hopeful or pessimistic that approach can be taken.
Well, first of all, I'm glad you're raising this issue. I think I'm off. Dramatic changes are urgently needed, and marginalized populations have to have their issues addressed. And I think the Biden administration is committed to that. The announcements about the interim people at SAMHSA, Tom Cordero, who I know, at ONDCP, Regina LaBelle, I know, they're committed to dealing with this. I've been dealing with this issue for over 40 years. 29 years ago, I wrote a disputed paper on supporting a needle exchange. And there's a lot of pushback because of the issue of stigma and discrimination. So harm reduction as a component, access to treatment, and making sure we've got people who are sensitive to the needs of the community. It's one thing to parrot that there are these issues of diversity, equity, and inclusion. It's another thing in having people in place who can recognize that these things are important. And you need concrete solutions. We don't need platitudes. We need people who can envision these concrete solutions and help put them in place. The administration's in a position, they've got people already appointed at high levels and will continue to, I'm sure, appoint people who can relate to the need for concrete solutions. So you've got all these departments, Health and Human Services, Department of Justice, HUD, Commerce, Education, Labor, all of these entities need to be brought to bear. And as Karen said, we need to recognize that a public health emergency exists that consists not only of the pandemic, COVID-19 pandemic, but also of substance use. And keep in mind that the overdose deaths continue to change. Just like you have variants in COVID-19, we are now not only seeing fentanyl, we're seeing stimulants like methamphetamines reemerge, cocaine's reemerge. So when you look at those 80,000 overdose deaths, there's a substantial part of them made up of stimulants. We need strategies like contingency management or incentive-based contingency management in place.
Well, thank you for that, and I love your commitment to this topic, Dr. Olsen. Your thoughts?
No, absolutely. I mean, I think that this is, if you look at kind of substance use disorders as well, they're not unidimensional. They are actually multidimensional. And so, we really need to take a multidimensional approach to be able to effectively address them. And so that means having, housing supports. It means having employment. It means having a robust workforce that also understands and can address these issues in a multidimensional way. I think both Dr. Clark and Mayor Freeman-Wilson, said it very clearly. This is a public health emergency that we need to really address as one. And so that means that we need the robust funding. We really need the robust kind of elevation of this issue. And so that we can actually then have the resources available to really be able to do that. Over the last several years, certainly Congress has taken steps towards doing that. SAMHSA's budget has nearly doubled over the last few years. And so I think there certainly is a recognition that this is an important issue that is affecting large areas of the country, large populations, and particularly the vulnerable populations, people of color, who then also have may need additional resources and additional attention. I think one of my colleagues, Dr. Ruchi Fitzgerald in Chicago, had said that addiction doesn't discriminate. But we then have the choice of how we respond. And so responding in an appropriately sized way with appropriate attention to all the needs of the people who are affected by this and the communities that are affected by this is really what is going to get us to the place where we can really address it effectively and comprehensively.
Terrific. I mean, I really want this conversation going on. We got a couple of questions from the audience. I'm going to try and squeeze in. We'll get real fast answers to them if we can. We have Sarah on board. Sarah?
Good afternoon. My name is Sarah Corcoran from Washington, D.C. On behalf of the Behavioral Health Information Technology Coalition, my question is, can you speak to the role that telehealth and Clara 2.0 will play in the mental health and addiction space, given COVID-19's exacerbating effect on mental health in the United States? Thank you.
What an appropriate question. Dr. Clark, you want to jump at that?
Oh yeah, when I was at SAMHSA, I was a major proponent of health information technology, including telehealth. And telehealth, not just for rural communities, although the issue of broadband is very important still for rural communities. We need to be able to exploit telehealth. We need to make sure that it is sustained not only during this pandemic, but after the pandemic, because it increases access to treatment. Everyone just about has a smartphone that has all sorts of capabilities. We need to be able to allow practitioners to reach their patients where they are. We need to also be able to promote recovery-oriented strategies, and telehealth will allow that, so that a person isn't just seeing their practitioner or their clinician once or twice a week, that in fact, if they need support, they got it 24/7.
Sure.
So organizations that deal with recovery recognize the utility of telehealth and health information technology so that it can enhance the recovery of people.
Terrific. Thank you. Karen, do you have a quick reaction to that?
I do. I believe that it is clearly a matter of health equity in terms of allowing people to utilize telehealth. And in fact, the Chicago Urban League is getting involved in promoting that because we understand the importance of telehealth in the health equity conversation.
Well, thank you. I think I'm going to jump to the next question because it's perfectly made for all of you, but particularly for Dr. Olsen. We've got Jake on board. Jake?
Hi, my name is Jake Jackson. I'm with the National Board for Certified Counselors. We're the national credentialing body for mental health counselors in the United States. I represent about 68,000 nationally certified counselors all across the country, and I'm based up here in the Washington, D.C. area. My question is, how can we address the impact of COVID-19 and the opioid crisis on Medicare beneficiaries in particular? Thank you.
Dr. Olsen, that's yours.
So that's a great question. You know, I think that the Medicare beneficiaries that are older, that, as Dr. Clark mentioned, many older individuals may have had long histories of substance use disorders. And because they also are now really being impacted by COVID, we're telling people to stay home. We're telling people, to stay inside their homes. That increases the isolation and loneliness. And so really figuring out how can we actually then keep people connected, keep them safe, and make sure that we're getting Medicare beneficiaries also access to vaccine as is being prioritized, kind of in many states and many areas across the country. I think that some of the solutions that we've talked about in terms of telehealth, for example, and having broad access to telehealth that includes phone and includes phone only. About 50% of my patients only have a phone that works as a phone, as opposed to kind of with a camera, and we have an average age of close to over 50. And so I think as the population is aging and we're making sure that they can stay connected, stay in treatment, as well as, really the harm reduction components are incredibly important. And so making sure that we can actually have a continuum that includes harm reduction, treatment, and recovery services, and particularly within, the Medicare program, Medicare Advantage plans that then are adhering to parity and really being able to actually provide all those services to the Medicare population.
My producer's going to get so angry at me, but I'm going to ask each of you one last question. I think it's really important with folks we have watching, and that is, we talk a lot about stigma. We talk a lot about, people hiding this because they fear the social consequences of this. I've gotten to know some folks in McDowell County, West Virginia, thanks to Senator Manchin, in part because of this issue and my interest there and trying to hear them and connect with them, be of help where I can. But I think a lot of people hear the word stigma. They don't want to stigmatize folks, but they have no idea how to actually walk the walk of that. I'm just interested in any life insights you have where people can really get over their own stigmatizing of others with this. I wish I'd brought someone on today who was suffering in this issue to hear their view of how they feel in this, but that didn't come together for this. But I want to hear, as you have all dealt with this, just a quick snapshot of what our listeners who want to do better than they're doing in terms of reaching out, understanding about not stigmatizing this. It's one thing to say it, it's another thing to do it. Any quick thoughts, Karen?
It's important for people to understand that this is just like cancer. It's like diabetes. It's a medical illness. It's a relapsing, debilitating challenge. And when people understand in the context of medical conditions that they suffer from, they tend to change their perspective.
Dr. Clark?
There are organizations like Faces and Voices of Recovery, organizations like Stop Stigma, and other organizations. So I want to encourage people to talk to people in recovery as well as talk to people in treatment or talk to people in need of treatment, all three groups. And once you talk to people in recovery, you can understand the benefits of recovery, not just for the individual interactions, but for the society at large. So I just want to make that pitch because Karen's point is well taken.
Thank you. And Dr. Olsen, last word.
I would say that, it can start with language. We can really watch, kind of the terms that we use. So avoiding stigmatizing terms like, abuser, addict, junkie, really saying, using terms like a person with a substance use disorder or a person with an addiction, saying that, it's a person who is in recovery, not necessarily clean or dirty. And so there's a whole host of non-stigmatizing terms that ONDCP, the Office of the National Drug Control Policy, put out under Michael Botticelli's direction during the Obama administration. There are fact sheets and tool guides, even for the press and media, that can help, really change language. And language matters because it certainly exemplifies, some of the attitudes that we may have towards this disease.
Listen, I really thank all of you. I added a few minutes to this session because it was really worth it. I want to thank all of you. Dr. Yngvild Olsen, Medical Director of the Institutes for Behavior Resources, Dr. Westley Clark, Dean's Executive Professor of Public Health at Santa Clara University, and Mayor Karen Freeman-Wilson, who's not responsible for the snow, President and CEO of Chicago Urban League, and former mayor of Gary, Indiana, a very historic mayor in Indiana, I should say. Thank you all so much for joining us today.
Thank you.
Thank you.
Thank you so much.
All right. Take care, everyone.
Bye-bye.